And so I make the emphasis with regard to our particular college's reputation, Democracy's College, not so much as a political observation, but in fact, in the United States, the kind of college in which I am located is called a community college. My college has 160,000 students on 8 campuses in multicultural, multi-ethnic, multi-religious, multiracial, multilingual Miami, a microcosm of the world, students from over 182 countries. And in effect, it's called Democracy's College because of the fact that we have an open door policy. What that means is anyone can approach the college with an intention to become competent, to seek higher education or advanced training or advanced certification. And as an open door institution, we are committed to bring you up to a quality of educational performance that would allow you to advance as you can, while in fact meeting the standards of the disciplines or academic requirements or professional requirements in a given field. So among our 480 different programs, through which we serve nearly 160,000 students, we basically are America's largest college of our kind. And I emphasize that because what is absolutely fascinating, as we have become aware in the last, like everyone else in the world, in the last 11 months of an epidemic that would become a pandemic, the social environment in which we're operating has no national policy, has no state policy, and has no county policy with regard to, in fact, managing a public response to perhaps the greatest threat to our social environment since an epidemic from the early 1900s. And so it's an interesting, if not peculiar, situation in which, in fact, you find a college attempting, in fact, addressing and eventually redressing the absence of social policy by which to both protect its membership as well as to effectuate a model for public health policy that would then serve as an example, perhaps, or at least one option with regard to addressing a major public health problem. For us, the prelude to making and creating our own policy, for lack of a national, state, or local policy to deal with the endemic, was basically between January 7th and March 13th. In our part of Western culture, Friday the 13th is supposed to be bad luck. But in any case, in the middle of a semester, an academic semester, the college had gathered the best science-informed, health policy guided, and basically educationally directed response to the pandemic virus as it threatened us in a 3 million member local community at America's largest college. I say science informed because the knowledge about the implications of COVID-19 that was disseminated and demonstrated to have serious consequences beyond its origin point by January 1920, we took our guidance from the World Health Organization and other legitimate scientific communities within the United States and elsewhere, basically knowing that in effect, it was going to be a model that would be best to protect our own membership, our own scholars, our own faculty, but through them, our own community. In the absence of a national policy and leadership, guidance and standards and best practice models, because of a national debate over whether it was better in the circumstance in which we found ourselves to remain open as a society with businesses and professions and enterprises and financial institutions, as well as educational organizations, or whether it was better to close and attempt to prevent the immediate expansion, the outreach of infection as well as mortality in addition to morbidity. We saw in our general society an either-or set of choices. And we chose to work at becoming a model, to provide a policy that would be a model, that would be a policy that would not only be for a higher education institution as a functional part of our social environment, as a functional part of our ecology of democracy, but also as a model which might offer ways of agreeing on a consensual approach, scientifically informed, public health guided, and mediated by people in higher education. We chose to basically distinguish ourselves by March 13th, about 1/3 of the way through our semester, to basically close our functional operation, give our students a 2-week break to adapt to a whole new way of public higher education, moving from face-to-face to what was called remote education. We gave our faculty 2 weeks, time in which, for those who hadn't adapted to the technologies that could enhance remote learning, to do so, and to do so with subsequent modifications in everything from essentially syllabi to lesson strategies, to research designs, and so forth. We also took that 2 weeks to adapt to our social transactional role in the community. As a community college, we have many students who come to school hungry, even though they may be working, but may be working at lower paying jobs. We have students with other transactions in their lives, whether it be families, whether it be jobs, whether it be other activities, which were also at the same time being threatened by the pandemic as it was manifesting itself in our community, our state, our country, and the world. Within that period, we also had to adapt some things we take great pride in, which has to do with civic engagement. Civic engagement is everything from registering to vote to providing sites where people can vote. We're one of the few higher education institutions, not only in Florida, but in the country, in which our students can vote on the campus itself, because we are community-based, serving many people who are otherwise occupied in addition to advancing themselves in higher education. We had a number of enterprises like that to essentially adapt to remote delivery without undermining the support that that would offer to those who benefit from it, as well as without threatening the health and well-being, the safety of those providing the service that complements our academic, experiential, simulation, and interactive learning approaches. In that 2-week period, essentially, for the most part, because it was anticipated in a consultative mode from our board of trustees to our management under the direction of what we call an incident commander. Sounds almost authoritarian, but in the case of an emergency like this, the incident commander, by consent of those of us working within the institution, we have a very consultative institution, working under a newly created policy by our board of trustees, which did not have any principal points of reference for lack of a national policy. We proceeded to treat the challenge as a community, as a collaborative, as a cooperative enterprise in which we basically were all in for the success and the uncommon good of as many people as possible that we could serve. We were also sensitive to the fact that because we don't provide health services as an institution, we had an obligation to connect, collaborate with, and work closely with public health agencies in our community to help identify those who either through self or by diagnostic discovery had in fact contracted COVID or were possibly symptomatic, asymptomatic, or otherwise potential carriers and spreaders of the problem. The challenge of being an institution as large as we are, in a community that's as big as it is, in a state, however, whose governor and local officials did not subscribe to required face masks, much less initial requirement for limiting business as usual in food enterprises, theater, gyms, as well as banks, supermarkets, and other activities that are essential being pharmacies, essential being hospitals, trash removal, and so on. We were in a social environment which was moving at many different speeds to basically develop a safety strategy for those delivering the services, as well as those recipients who needed and who in effect benefited from remaining effectiveness of essential services. Essential in our case was education, is training, was role modeling an institutional approach to containing the spread of COVID, but nonetheless also providing an educational experience that would not further slow down or hinder the progress of the thousands of students that we served. At the end of those 2 weeks, we were suddenly, essentially, by April 1st, which again, in Western culture, April Fool's Day has a double meaning. But for us, it was essentially April Affirmation Day. As we came online, we were remote but not distant to the students whom we had been serving face-to-face less than 3 weeks earlier. We were essentially in a new mode of instruction, which favored some people's learning styles and was a bit of a shock for others. We were interactive with the delivery of research, advice, and guidance through our technologically adapted library system. We had provided laptops as well as hotspot identification so that every student that was now being taught remotely, whether they were the least economically capable or the wealthiest, were able to participate in this transformational approach to remote or virtual learning. What resulted from that transaction was very, very important. The transition basically was facilitated by positive messaging, by, again, equipping people with knowledge about those who were basically at risk of hunger with regard to social services and other things, which in addition to formal education is a part of what sets up people for success in our unique institution. remote became virtual, but in effect, it also allowed for the development, in fact, the conscientious instructional self-aware development of different as self-learners in addition to lecture learners, problem-based learners in addition to just text and research learners. It provided a dynamic which was awkward at many times for faculty. I'll speak for myself as much as anyone. My humorous description of my own transformation was virtual naysayer, meaning someone who was never going to substitute face-to-face for technology, to virtual, in this case, virtual technology, virtuoso, doing things I never expected to do in an organized, systematic, and still creative, and still participatory, and still basically advancing my own approach to multiple intelligence theory and learning, which might be very different than my colleagues in the natural sciences and in other disciplines. And we proceeded to have a network in which we shared progress as we advanced, actually enjoying the journey, almost a kind of an adventure, which indeed it was. While we were implementing this approach, students with the most non-academic responsibilities, least resources, and other challenges were in effect messaged and included in answers to some of the challenges they were dealing with. Faculty uncomfortable with remote teaching or familial complications. If you're teaching at home suddenly with 5 children who are also learning distantly at the same time, it's not quite the same as being in a classroom or a traditional lab or other learning circumstances. But in the process, May Day, May 1st, was the date at which our semester ended. And May Day wasn't a signal for help, we're sinking, but May Day was not dismay day, was not a disappointing day. From my own anecdotal perspective, I would say my 189 students that I started the semester with had indeed not just completed, but had blossomed in a number of ways unanticipated at the outset. And because of the technology involved in what we call Blackboard, others have other technology adaptations, we actually had a better database of their achievements to which they could refer as they would go on to transfer to other schools or employment or advancement or other opportunities. There was kind of a celebration, although also commiseration, because among my students, 14 had contracted COVID. Among my students, those who negotiated, much to my surprise, I would have said goodbye if you feel a need to, first of all, take care of your health, second of all, your family, third of all, I put my role, frankly, fourth, because I think we not only have to be empathetic, but we also have to be supportive and appreciative for others who are in mental health circumstances that were previously unexperienced, at least in my community, even though we have many refugees and others who have been through many different types of trauma. COVID represented a different kind of challenge. What we determined at the end of that semester, while in fact we did not have a formal graduation, we will finally be having a virtual graduation, belatedly, next Saturday, as a matter of fact. But in effect, life went on in terms of credentials, credits, and other basically transfers of competencies and so on. But what we did, in fact, have as a result, what we learned that semester, we used the summer to further adapt 3 approaches to the advancing pandemic and its slowly adapted management in the public sector, by looking at remote learning, synchronous and asynchronous learning, meaning like now we are synchronous, but if we weren't, at the end of the day, you might go back and review what we're doing right now, and blended, as well as eventually back to face-to-face learning. We had a number of models from which we chose to then springboard into the fall semester, which we're currently in. As a result, and a self-study, a copy of which I provided to the Secretariat for sharing with anybody who's interested in the way in which our administrative team identified precedents and legal options for what we were doing, guaranteed assurances for people on financial aid, and for other people. We have millions of dollars from government and foundations that support individuals to participate in our school. How do you manage all of that? And then also demonstrate the effectiveness of it. And we came up with a very successful model, which in effect we're continuing to extend basically, and are currently now in the midst of, as we approach a day in our country we call Thanksgiving. And we have, despite the trauma, tragedy, growing death rate in this country, one of the highest in the world from COVID, and one of the highest infection rates, as well as numbers in the world, we still have a disruptive national policy environment and a disruptive, Florida is one of the 7 states that still does not require, mandate basic interventions like social distancing, masks and so on. We have at least provided what we like to call a candle and a mirror in a policy that has worked in a major social institution that has had subsequent benefits to the thousands that we serve, and that we hope will essentially provide not only our students of how they may become civic engaged change makers by in effect making that which is necessary to change in a democracy which is sometimes messy, in a democracy that is sometimes essentially slow to move, but in a democracy in which ecology, we can be democracy's college by what we have done, by what we have learned to do, and by the excellence demonstrated by those participating in it. And so in respect to our timing, my major points were that as an individual institution, this one, our Miami Dade College, was motivated, activated, and basically self-equipped and then equipped by existing public law, by existing public health policy, and by existing other best practices from the Academy of Sciences, the World Health Organization, sadly from which my own country has been rather distant. We've basically demonstrated what democracy is when it's at its best. And sometimes it has to be from the ground up when different other levels are conflicted. We are anticipating a transition, both in not only leadership, but public policy nationally, and then many other levels, including our own county, which heartens me a great deal, and within which our institution is considered to be a model, as it was under the Obama administration, it will be under Biden. So that's the only political observation I will make. But the hard work of getting there, from the point of higher education, was equipped and informed by some of the models elsewhere around the world, and in effect, trying to be an institution that shares. So thank you for letting me share these observations. And I'm really thrilled to be interconnected with each of you, because in the final analysis, we are interactive, we are interconnected, and we're interdependent in a global community, which can only be energized, made safer and healthier when institutions of higher education and higher calling work together through colleagues like those connected through the World Alliance of Universities and Community Development, and the good people that are involved in this enterprise today. Thank you.